this video, let's look at how assistive AI is helping clinicians and administrators in healthcare. This is part of a sabbatical project in academic year 2024-2025 at Mount San Antonio College by Professor Kim Lalani Nguyen. Remember, assistive AI is generative AI to help make completion of tasks efficient. So one example would be in radiology. Let's say there's a chest x-ray or an MRI or a CT scan. Anything along those lines requires a radiologist to take a look at the images and then making a diagnosis. Well, with assistive AI, the AI will view the image first, analyze it, and then give the physician their preliminary findings. Another field in medicine that has a lot of images will be pathology. So in pathology, human tissues are examined underneath a microscope to make the diagnosis. For example, if a patient has a biopsy, well, then a pathologist would need to look at those slides to confirm if there is cancer cells or not. So with assistive AI, the AI will look at these images before the pathologist and saying, like before with radiology, the AI can make some preliminary diagnoses, after which point the doctor, the pathologist, will then look at it and either confirm or deny the findings. And many of you have heard of ECG, electrocardiogram. That's the heart tracing you see there in the image, and it tells you what's going on with the heart, electrical system. So in the past, once the electrocardiogram has been produced, we wait for the cardiologist to read it and to make their diagnoses. Well, now you guessed it, assistive AI has the ability to look at the ECG and make a preliminary diagnosis, which will then be given to the doctor to agree or disagree. Not too long ago, there was a law that was passed called the 21st Century Cures Act, requires patient to have immediate notification of test results. By the way, this is one of the factors that's expedited the electronic health record. So in the past, doctors will get the test results and then look at it before calling the patient. But now with this recent law, patient must be notified right away what the test result is. Unfortunately, most patients don't have the medical background to understand the test results. So this is where AI comes to help. Assistive AI will look at the test results and explain it to the patients, cutting out the waiting time for the doctors. So currently at University of Colorado Health, they are looking at ChatGPT and giving ChatGPT images of CTs and MRIs reports. And then have ChatGPT summarize the finding to see how accurate and how easy to understand it would be for patients to use this assistive AI. So in this case, we're helping patients as well as doctors to speed up the process of getting information to the patient. Assistive AI is not just helping doctors and patients, but they're also helping hospital administrators and people who handle the paperwork. For example, every medical diagnosis has a special code. And in the past, the coding process is done by a person. Sometimes it can be cumbersome, sometimes it can be slow, but now assistive AI is kicking in to help speed up that process, and they can probably do it, assistive AI can probably do it more accurately as well. Now, once the code is in place, oftentimes patients will require prior authorization before the medical treatment can be given. So guess what? Assistive AI can also help with that process and speed up the time for prior authorization so that the patient can get treatment sooner. Oftentimes, hospitals cannot wait for prior authorization. They have to give the treatment immediately because it's an emergency. So in those cases, after the treatment has been given, the hospital will file a claim to get reimbursed with the insurance company. Now, it's not always easy because oftentimes the insurance company will deny the reimbursement, and then the hospital will have to file more paperwork for an appeal. Okay, so guess what? Assistive AI is also now here helping that process. Assistive AI can fill out the paperwork for the claim and also draft the appeal letter in case a claim is denied. So it's all done almost instantaneously, saving a lot of time and getting the hospital reimbursed quicker than before.